The holidays, doctors say that they are seeing a spike in people being admitted to the hospital with severe illness from COVID.
Yeah, so medical reporter Meg Ferris is here to explain what's going on and who really needs to take the most serious precautions, Meg.
Exactly, and we have that answer tonight. It's news none of us wants to hear, especially before we all gather on the streets for Mardi Gras parades. And tonight, doctors say there is a specific group of people who are most at risk. State health officials say COVID hospitalizations are up in the state almost 60% from last month. So are deaths from COVID. But this surge is not threatening hospital capacity.
In New Orleans, we are seeing a bit more hospitalizations, but it's obviously nothing compared to what it was before. It's usually in a really at-risk population, though, more so than we even saw before.
Tulane Director of Medical Intensive Care, Dr. Josh Denson, says this time severe illness is hitting one group.
The people that are getting it and actually getting sick from it now tend to be more frail, more immunocompromised, or have immune deficiencies.
A new Omicron variant is circulating, XBB.1.5. It's more transmissible. The World Health Organization says it's the most easily spread. There's no indication that it causes more severe illness. Both previous Omicron infection and the latest booster offer you protection. The state health department says there is no reason to think there will be mandates.
Most people in the population have either been vaccinated and boosted, or they have been exposed to the virus itself either once or twice. And therefore, I think they have more immunity. So we're not seeing the same level of disease that we were seeing before.
That's 95% of us in Louisiana who've had vaccines, the infection, or both. So here's what you need to know. And this is especially for people who have a low immune system.
The vaccines are safe. The boosters are effective. It's clearly saved a lot of lives. And we're not having as many people dying in the hospital, despite having obviously an increased number of cases.
I would recommend that if you're not vaccinated, get vaccinated. If you haven't gotten the bivalent shot, get the bivalent shot. And then think about masking intermittently when you're in a public situation, and test before you go see anybody medically vulnerable.
Now, if you're headed out of town for Mardi Gras, listen to this. A study found that the COVID virus was found on nearly 96% of the planes that were tested. So if you're going to be flying, you may be that time that you wear that N95 mask, not one of those paper ones, when you're on the plane.